Good morning, everyone. Thank you so much for joining me. My name is Shushanova Dallas. I am a master's degree student at the University of Hartford. And this semester, we are tasked with identifying a problem in healthcare and proposing solutions to solve it. My problem that I decided to address was medication non-adherence and seeing how nurses could impact this problem. Some background on the topic at hand. Medication non-adherence ranges from 40 to 70%. This leads to higher complications in their health, higher healthcare costs, and more hospitalizations. Patients with a higher understanding of medication's purpose, understanding of the disease being treated, tend to have higher compliance rates. They tend to do better and have less hospitalizations. Nurses have the ability to impact non-adherence through education, to promote better understanding and better compliance. Patient education is already a foundation of nursing. The purpose of this project is to see if we can reinforce the nurses' knowledge of teaching strategies that will ultimately lead to improved patient recognition and understanding of their medication. The clinical question being addressed here is, will medical surgical nurses score higher on a post-test after education session on best teaching practices for teaching patients about their medication? Is the pre and post survey that I'll be asking you to complete. This survey addresses how you currently feel about the level of education that we are currently providing and how it changes after this presentation. This presentation does not create new ways of teaching, just reinforces what we already know and asks us to implement them daily. There are several contributing factors to the problem of medication non-adherence. Education is only one intervention that the nurse has. The nurse can directly impact this problem through education, and the studies here support it. This study that I'm sharing with you here found that nurses typically spend only 5 to 9 minutes per patient on medication education. From experience, we know that that's usually done during our admission profile and on discharge, where you review the list that the patient is going home with, and oftentimes patients do not understand what these meds are, the doses, the frequencies. They tend to have a lot of questions during this time that could be addressed earlier in their stay, and sometimes their families are hearing this list for the very first time. So let's get into these strategies. The first strategy is to perform an assessment. Assess where your patient's current level of understanding is. Are they able to understand the teaching material? In this time, you want to consider the patient's education level, their language, and their support systems. Patients with low health literacy tend to not understand the education being presented and may need some additional support. Please assess the patient's learning style. Do they prefer written, verbal, or video? We have access to these formats of teaching materials, and we can tailor our education to help the patients understand at their level and in their way of learning. This strategy addresses the actual education. In this step, we will reinforce and re-educate. We will review and repeat. We will assess where the patient is, what they already know, and address any knowledge gaps that they have. We will speak on the new medications that they are being prescribed, teaching them about their purpose, dose, and frequency. We will do the same review for the existing medications that they came in with. We will use the formats that they identified as their preferred learning styles, whether written, video, or any other formats that you have access to. Here we will simply repeat, 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 and help the patients increase their understanding of their medications on a daily basis. This strategy reminds us that we have resources at our fingertips that we have access to help reinforce the teaching that we provide. Whether just using one-on-one teaching or accessing educational materials through technology from databases like Lexicomp or the clinical documentations that's located in the EPIC Discharge Navigator, or patient portals, whether using written materials that have been provided for us by the education team. We have several different ways of reinforcing education, and we should use every single resource we have available to reinforce this education because it is super important and it will change their lives. One resource that is often overlooked is the support system. Use the patient's family, caregivers, and their other services that they have assigned to them to reinforce education. The patient may not be the one that's dispensing their medication, making the medication packets, or anything like that. So it is really important to include family and caregivers into your education when you see them. Make time, set up appointments, do what you need to do to get them involved in the care, because including them will improve the patient's compliance. Work with the patient's pharmacy. Do they have home delivery? Is there a nurse coordinator that can help with education after discharge? Including other members in the education plan only improves the compliance rates, because during the hospitalization, patients may not remember everything that you have done. They may not remember all the teaching that you completed. By including outside forces into the education, you only increase the retention and the compliance that can be had from this education. Education has been completed, it is important to identify proof of understanding. Using the teach back method, we can figure out, did they understand the education that was provided? By asking them questions throughout the shift, completing little quizzes throughout the day, we can see if the patient understood the teaching that was provided. We can address any gaps that we identified throughout this time. Feedback is important because it helps us advocate for the patients, giving them additional resources if needed. We can also use this time to set up follow-up resources to help reinforce education after discharge, such as following up with your primary care office or contacting the nurse coordinator that is assigned to them to help them set up resources to help the patients continue education outside of our time. As stated before, education is not a new strategy. It is not a new intervention to nursing. It is already a foundation in nursing practice. However, there are several barriers that limit our ability to perform this intervention. Whether it is time, workload, or patient acuity, we often see that there are things that prevent us from being the nurses that we wish we could be sometimes. So we can address the barrier of time by making time, getting creative with our education, and inserting ourselves throughout the day, even if it is 2 minutes at a time. By addressing workload, this is the hard one to address because sometimes we realize that with a higher assignment, with being short-staffed, we do have limitations there. But we can try to work around it by just sprinkling in the education as we see fit throughout the day. We cannot impact patient acuity. We just have to work around it. Patients are sicker these days. They are coming in higher numbers. We just simply have to be creative, as I said earlier, and try to work around this. If the patient is in pain, that is not a great time to teach. Wait till they are ready to learn and use the time that you do have appropriately to maximize the education that we can provide to really improve their overall outcomes. Summary: nurses have the power to address the problem of medication non-adherence through education. Nurses can assess, review and repeat, use their resources, and check for understanding. Using these strategies, nurses can really impact the overall outcomes of our patients. They can increase compliance and increase patient adherence over time. These are not new, profound strategies, but they do compound over time, as I said, and can lead to substantial changes in our patients' lives. Daily teaching leads to more compliant patients, which leads to better outcomes. This study by Boyd et al. Just reinforces the importance of this intervention. Patients who are more knowledgeable about their health are more engaged. They are more compliant with their interventions that they are taught. This is a very important intervention that can have a huge impact on a patient's life. Education may seem so simple, but it is so powerful. These are some of the articles that were used in research for this project. Please feel free to access and review them at your leisure. I just want to say thank you everyone for participating in this project, for giving me your ear, for working together to improve medication education that we provide to our patients in an effort to improve the issue of medication non-adherence. As you can tell, I am passionate about this topic, as non-adherence leads to very poor outcomes that impact not only our patients but us as well. When our patients are non-compliant, the workload only increases for us. Thanks you again for everything that you've done to help me, the educators, and the leadership to get this project completed. Thank you.